everyone, happy afternoon, a very good afternoon. I hope and I believe all of you are doing well. A quick note whether I'm audible and visible. I am not able to see. Just waiting for the live chat and for your confirmation. I'm not able to see the live chat. A quick note whether I'm audible and visible, everyone. Yes, okay, that's great. So, why are we doing this recall? I know that seeing the recall does not change your answers, whatever you've marked in the exam. It does not change your scores. And I know that some of you are anti recall type of people. So, this recall is not meant for the students who are done and dusted with their exam. Like this was the last exam that you had given. But for the students who are planning to appear for the upcoming exams, be it INICET, be it NEET PG, be it FMG, because we are seeing a lot of overlap in the topics and the questions that are being asked in these exams. So basically, this is for learning perspective because you never know that whatever we are discussing today might appear in one of the upcoming exam. Okay. So I would really like to thank one of the students. From Ahmedabad who contributed and helped in this recall and wouldn't have been possible without him. So thank you so much for that. And we have successfully tried to recall all the 200 questions that were there in the exam. And again, remember that it is the INICET recall is difficult than the NEET PG recall because there were multiple options, correct type of questions. But as I said, the purpose here is to learn rather than calculate your scores, right? Your scores are not going to change and the results will be there in the next 3 days or so. By Saturday, we'll get the results, right? So this is basically for learning. Okay, this is for learning. All right, so let's start with the discussion of the 200 questions. And this time I've got a lot of references and proofs also to show you that why this is the answer to a particular question. And please let me tell you that do not take the answers to this recall like the foolproof answers, because you know that there are few controversial questions also. We'll be discussing those, and you never know that what the examiner thought of the answer when he said the question. Like for example, the question of the complication not seen in massive transfusion, right? So I'll show you from the Bailey and Love the reference, but we never know कि examiner ने कहाँ से लिया है इसका reference. So that is why there are controversial questions. And I am giving you this disclaimer at the outset itself because I don't want any one of you to come back after the results saying, "Ki based on your recall, this is the score that we had expected, and now after the results, we are getting this score." Because there are many bias that we have when we look at the recall. First, we don't remember exactly what did we mark in the exam. I'm sure like after 2-3 days, we tend to forget that. And as I said, we don't know कि examiner ने answer क्या mark किया है. ठीक है? I know if you ask me personally, I feel that this exam had a lot of bouncers questions, thode se. And I personally feel that a score of around 145 should be like the top scoring ranks. 145 to 140 to 145 should be in the top 100 ranks, right? But let's see when we get the results. This is my personal opinion on that. Okay, so let's start with this one. So I have segregated the questions subject wise, so that we also get a hint that how many questions were asked from each subject, so that the students who are planning to appear for the upcoming exam, they know that how is the weightage of the subjects. So in anatomy, there's of course the overlap of the subjects. I cannot put a particular question in one particular subject, like the question of lateral medullary syndrome, pica. It can be anatomy, it can be medicine as well. So anatomy, according to our categorization, are 11 questions in anatomy. The first one, which was comparatively difficult one as compared to the rest of the questions. So cranial nerve functional columns, arrange them. It was the afferent columns arranged in the sequence medial to lateral sequence. So INICET did have questions which are multiple options correct, arrange in the sequence, match the following, assertion reasoning, right, and single best option also. So this is the sequence basically that we have for the afferent columns. First is the GVA from medial to lateral. First is the GVA, then is the SVA, then is the GSA, general somatic, and then is special somatic. Like I said, I had got the image here, which I am not able to see here. Just give me a minute. I'll see that if I can show you that image. Had put an image here. पता नहीं कहाँ गायब हो गया. ठीक है. Right, this one. So this is what we have here. Just a minute. Again, the slide is gone of the arrangement of the columns. Right. So look at this one. Basically, the arrangement of the columns here is what we are seeing here. So this is the midline that we are seeing. We know that motor is medial. So सबसे पहले आते हैं motor और फिर आते हैं sensory. Motor are more medial. Even in that, in the sensory columns, the afferent columns, you can see that the first one which is given here is GVA, then is SVA, then is GSA, and then is SSA. So basically, this is the arrangement. The vestibulocochlear is the lateral most. Okay, the vestibulocochlear is the lateral most. बीच में है आपका trigeminal. We know that 3, 4, 6, 12 are medial. The somatic efferent, right? The general somatic efferent, then the special visceral efferent, and then we have the general visceral efferent, right? So this is basically the sequence: the GVA, the SVA, the GSA, and the SSA. Okay, and the SSA. Auditory pathway, there were 2 questions, and I believe that this would be easy to solve, very easy. If you know this, you get 2 questions right away correct. So first one is going to be spiral ganglion. That is what the option was. Then you have the cochlear nucleus, superior olive, lateral lemniscus. Then you have the inferior colliculus, medial geniculate body, and then you have the auditory cortex. The examiners were very smart here in the sense that the auditory cortex was given as the last in all the options. So you could not use that trick there. Ulnar nerve diagram, basically this is the previous year question, has been asked in the previous AIIMS exam, same to same question. So you were given that a person cannot hold the card between the fingers. So that is the interossei, palmar interossei gone, which is the ulnar nerve. How do you identify that? Is basically by, look at this one, towards the head, right, towards the greater tuberosity, basically would be the lateral side. The ones towards the head where it is facing, that is the medial side, right? So this is going to be the medial epicondyle where the ulnar nerve is gone. Okay, that is the medial epicondyle. Match the following for the nerves, the functions. This was an easy one. Like mandibular nerve is for chewing, the accessory nerve is for shrugging the shoulder, and you had the 7th nerve and the 9th nerve. Okay. Next one that you have is rhomboids ka action. This was a confusing question here. Don't exactly know what will be the correct options there. But the concept is that rhomboids, they cause the retraction along with the trapezius middle fibers. They also elevate, and remember, they take the glenoid down. Okay, they take the glenoid down. So this is what I've added here basically. You can see here, what are we seeing here? Right, so look at this one. The middle trapezius and the rhomboid muscles, they cause the retraction. So together they cause the retraction, not the elevation. I think that was one of the options. So middle trapezius and rhomboid, they cause the retraction. The middle fibers of trapezius, they are only the retractors. whereas the rhomboids are retractors, plus they rotate to depress the glenoid fossa. So rhomboid muscles retract, rotate the scapula down, and they elevate also. Okay, so the best answer will be the retraction and taking the glenoid down. That is what would be the best answer there. Next one, superior gluteal nerve, the muscles that it supplies, it's gluteus medius, minimus, and tensor fascia lata. It is not piriformis muscle. Next was the image-based question of the lateral medullary syndrome that was given. So the artery affected is pica. Incorrect about the male gonads development. It's bipotential at 8 weeks. No. Until 6 weeks is when it is bipotential. Right after that, it differentiates into male and female. Okay. So remember that it is, this is basically your male gonads development. Not the anterior relation of D3. Okay, pneumocystis. I'll try to do that next time. Anterior relation जो नहीं आता है, gallbladder is not going to be the anterior relation. Right. So what do we have there is, let me show you this. The direct question here. Okay. So the direct question there for the anterior relations of the gallbladder that we have there. Look at this one. So this is the anterior relations. These were the options: the superior mesenteric vessels, the root of the mesentery, and the jejunum coil. All of these come anterior to the, third part of duodenum. So the answer is GB. Next one I would say was an easy question कि trachea, esophagus, recurrent laryngeal nerve जब compress होते हैं. So what symptoms do you get? Trachea is dyspnea, esophagus is dysphagia, recurrent laryngeal nerve is hoarseness of voice, and sympathetic wala is the horners. Okay, sympathetic wala is horners. So I would say that anatomy was relatively easy, except for a few questions here, like the arrangement of the cranial nerve columns. And this was a bit confusing, the action of the rhomboids. Right, otherwise it was relatively easy. Next one, hypoxia. Okay, the graph of the hypoxia was anemic hypoxia. Why? Because the oxygen content had gone down. We have discussed this in our short sessions also, that in anemia, okay, remember anemia, ARDS हमने याद किया था. The graph goes right and the graph goes down. The oxygen content decreases. Again, I have a graph to show here for the types of hypoxia. Look at the types of hypoxia. Look at the stagnant. Look at the hypoxic. Look at the histotoxic. Look at the oxygen content. The graph is down with the anemic hypoxia. Okay, the graph is down with the anemic hypoxia is what we are seeing here. Okay, so the oxygen content was decreased, significantly decreased there. The oxygen content was significantly decreased there. The PO2 of the arterial blood was normal. Okay, the PO2 was normal, and that is why it was anemic hypoxia. Wind-Kessel effect is not seen in radial artery. Remember, Wind-Kessel effect is seen in large elastic arteries like the aorta. The other options were renal artery, right? We see there. So remember that the Wind-Kessel effect is not seen in the limb arteries. One graph-based question of the Valsalva and the blood pressure changing. It's because of the compression of the lungs. What leads to that? Because of that, there is increased venous return to the left atrium. The increased intrathoracic pressure compresses the lungs, and the venous return to the left atrium increases, and that is what then increases the blood pressure. That should be the answer there. This is a confusing one. Wherever there's a doubt, I've put a question mark there. Excitation, contraction, coupling. If you remember all the options, do let me know. So this seemed to be incorrect, that voltage-gated calcium channels do not play a role in the contraction of the skeletal muscle. Right. We do have this screenshot that I've got. So the voltage-gated calcium channels, basically, they do not function as a channel, but they are required for calcium release from the intracellular stores. Right. So remember that these calcium currents, they are required for causing that. 14 was a direct image from Ganov. Okay, so need to check that. Next one, this is also a doubtful question, the Nernst equation wala, which was assertion reason type of question. The assertion was somewhere related to phosphates and proteins. The permeability of those is the major determinant of the RMP. They do contribute to the determination of the RMP, but we know that the major is potassium. We don't know the exact language of the question. And I don't remember the exact option, whether it was Nernst equation is used for determining the RMP or it was Nernst equation is for the equilibrium potential of the ion. Because the catch there is, if you look at this one, the equation which is used for the resting membrane potential is the Goldman-Hodgkin-Katz equation. Okay, so I don't know what the reason was given. And remember, it's not the Nernst equation, because Nernst equation is for the equilibrium potential for a single ion. कि potassium का equilibrium कितना है, sodium का equilibrium potential कितना है. For the resting membrane potential, we use the Goldman-Hodgkin-Katz equation, right? So, and the potassium equilibrium potential is the major contributor to the membrane potential. But remember that the negatively charged intracellular proteins and organic phosphates are also contributory. So, what exactly was the question? Is basically the language will decide that. If it was telling कि RMP के लिए Nernst equation है, तो वो गलत है. For RMP, it is a Goldman-Hodgkin-Katz equation which takes into consideration multiple ions. If it was telling that proteins and phosphates are the major contributors, more than that, it is the potassium which is a major contributor. So I'll put it in the query wala thing. We don't know what the examiner had in mind while setting that question. Next one, bitter taste is alkaloid. We also have a screenshot for this. So for bitter taste, basically we have the nitrogenous substances which are very important and the alkaloids like quinine, caffeine, strychnine and nicotine. Right. So remember that for bitter taste, the answer is going to be alkaloids. This was a good one where we had discussed the mnemonic for this. Mazi is our mnemonic for the arrangement of the lines and the bands. This is andar se bahar. The question was arranged in the sarcomere from periphery to the inside. We know that the periphery is the Z. Z to Z is the sarcomere. And then you have MHA, right? So the sequence is going to be ZAHM. That is Mazi. So that is the correct sequence from the periphery to the center. Airway pressure 0 at what volume? It is the FRC. A sort of repeat question from the last INICET. Another image-based question of the second messenger where the jack was given. You could easily rule out the options here even if you did not know directly कि इसका answer leptin है. But by ruling out the other options like calcitonin and whatever were the other options, you could come to the answer that it is leptin which acts via jack. GI hormones, the cells were given, all seem to be correct. Do not get confused between the M and the M0 cells. Again, examiner's mindset. I have put it here basically. So look at this which is given कि mortalin is secreted by the M0 cells, but they are also referred to as the M cells. So this might be correct, this might not be correct depending on what the examiner has in mind. If the examiner calls the M0 cells as M0 cells only, then the M might be incorrect because the M cells is also called the microfold cells. These are the ones which are found in the Peyer's patches. But according to me, all seemed to be correct. Right, so the M cells is basically the M0 cells. You had the S cells, you had the I cells, you had the gastrin vale cells in the stomach. Those were the sites of the GI hormones. So this is what we had in physiology. So basically approximately 10 questions in physiology, and they were a bit tricky ones. Like majority of them were a bit tricky, but using some logic, you could have got the majority of the questions right. So these are the 10 questions that we had in physiology. Coming to biochemistry, the liver ketone bodies wala. Liver cannot utilize the ketone bodies because of the absence of thiophorase. Another one, the Rothera test, which was the image-based question, which was given a purple ring there. The patient was diabetic patient, right? So that is Rothera's test. Increased xanthurenic acid levels are seen with vitamin B6 deficiency. This one where you were asked to identify the RNA sequence. The template strand was given and you were asked to identify the RNA sequence. The template strand was given in 5', 3' direction. What you had to do was you had to reverse it. It is not that just you had to do T ka U. That was not the thing. Because you know that the template strand from our mnemonic, if you remember T for T, it is read in 3', 5' direction. So let's say the sequence was GATC. For example, the sequence was GATC. The template strand will be read in this direction. This will be 5', 3' for the RNA. This will be G, this will be A, this will be U, and this will be C. Right? So the direction will be this from 5' to 3'. It will be GAUC. Okay, it will be your GAUC. That is what you would be having here. Okay? So remember that this will basically be the sequence that you will see. You will have to do in the ulta direction. Next, what was the incorrect statement? Collagen most abundant amino acid is phenylalanine. That was the incorrect statement there for collagen. High fat meal according to the FDA. So I've got a screenshot here basically to show you the values of the high fat meal. In the high fat meal, it is that the percentage calories from the fat should be more than 50%, not more than 80%. So that is incorrect. The total calories is 800 to 1000 calories. Out of that, more than 50%, that is 500 to 600 should be from fat. So I don't exactly remember what were the options, right? So, but this is what you need to know, that in the high fat diet, the total calories is 800 to 1000, and from the fat, it is 500 to 600 calories, which is more than 50%. Okay, which is more than 50%. Okay. So that is about the high fat meal. So which is more than 50% from the fat, and the total calories is 800 to 1000 calories. Pompey's disease was easy. Alpha glucosidase deficiency. Barth syndrome, a new one. It is the deficiency, the defect in cardiolipin. Thermic effect, something that we had discussed 2 days before the exam in the biochemistry class. Maximum thermic effect is proteins. This is basically doubtful कि DNA sequence alteration के लिए क्या use करेंगे. Definitely the flow cytometry should not be included. It is for basically to look at the CD markers on the cell. Pyrosequencing, RFLP, fish. I'm not sure about the fish also. So personally, I'm putting it in the query wala. Okay, I'm putting this in the query wala. Next one, where do you have a high smooth endoplasmic reticulum? Basically, if it is the cell which is steroid hormones, because the smooth endoplasmic reticulum is required for steroid hormones. Okay, so this is basically from biochemistry. So I would say, yeah, easy to moderate, not very difficult except for 1-2 questions. So you are seeing basically in all the subjects like 2-3 questions are out of the box. Otherwise, majority are doable. Coming to pathology, what did we have in pathology basically? Necrosis, the false statement is it is physiological. It is never physiological. It is pathological. The cell swelling is present, right? The inflammation is present. The substances go out. Those were the correct statement. For BRCA1, all of them were correct. Again, I'll show you the reference slides later on. So BRCA1, it's a tumor suppressor. It is associated with ovarian cancer. There is association with Fanconi's also. And it is involved in double-stranded DNA repair. Okay, the double-stranded DNA break repair. Stain wala image, whether it was amyloid wala. I hope you are able to see the question number now or no. Okay. Right. Stain wala that we have, let me show you the image of the stain. The image was something similar to this, right? So if you look at the HNE staining and you look at the Congo red staining, It was not like pink and blue, the proper wala pink and blue. It looked something like this. The red and the blue color is what we had. So it is more in favor of the Congo red staining, which is used for amyloid. It was not collagen. Collagen is Mason trichrome, where it looks blue. Elastic fibers, the Verhoff stain is where it looks black. Okay, so that will be blue and black. So that is Congo red, which is amyloid. Amyloidosis, we had quite a few questions on amyloidosis. You can see 3 questions here. So false statement, AL is secondary. No, AL is primary. Your pathology books do mention that amyloidosis is called amyloidosis because of the resemblance to starch. So that was a true statement. AL is primary. The other options was it was extracellular deposits, right? And on it shows the X-ray crystallography. You have the beta pleated sheets appearance. Okay. Next one, amyloidosis and dialysis is beta 2 microglobulin. So amyloidosis, you had 3 questions on that. Next one, related to the blood products. What do you have related to blood products? So blood products storage, the correct statement was about the platelets. It is 20 to 24 room temperature for 5 days. Okay, RBCs are refrigerated 2 to 6 degrees centigrade. Okay, so that was the correct statement. Blood tube draw sequence, that was the sequence. First is the blue, then the red, then the lavender, and then the gray. So basically glucose wala, sugar wala is the last. Your citrate, PT, APTT wala is the first there. So remember, that is the correct sequence. Then you had a question on that fungus wala, Mason Fontana, red pigment diya hua tha. The answer to that is Talaromyces. Okay, that's Talaromyces. Another question, regulation wala, is your AIRE1. Okay, when it is affected, it leads to your autoimmune polyendocrinopathy. The answer to that is AIRE1, the regulation thymus wala. Okay. Anti-apoptotic is MCL1. Okay. House MD, because the red pigmentation was mentioned, and that is why it was Talaromyces. Okay, that was another clue there, the red pigment. Anti-apoptotic is MCL1. I personally remember it as anti-apoptotic, means the apoptosis is not happening. So you remember it as may the cell live long, MCL. So may the cell live long, that is anti-apoptotic. So that is the mnemonic there. This is a doubtful one. ANA, speckled pattern or centromeric pattern, just the half image was there where it looked like speckled, but we don't know whether this is a technical glitch. So whether it is red pigment was mentioned. Right. So, so remember speckled है कि centromere पता नहीं. Electron microscopy, hairy cell ka image was there, the cytoplasmic projections there. Smut cells was given, the diagnosis being CLL. The best investigation there will be flow cytometry. Pedigree wala image, that was autosomal dominant, no skip, that is what was there. What is the location of the SRY gene? Remember it as short region of the Y chromosome. SRY, the trick to remember is short region Y chromosome. Okay. Next one that we have, this was a new question sort of thing. 46XX gonadal dysgenesis. It was a long question. 80% of the cases are what? Because of SRY inversion, SRY deletion, SRY point mutation, or SRY translocation. So when I searched for the references, the answer given is translocation. So this is what you have here. 46XX gonadal sex reversal syndrome, also called as 46XX gonadal dysgenesis. And this mentions that this condition may occur if the SRY gene, which is present on the Y chromosome normally, is misplaced onto the X chromosome. So basically, it is a translocation. Okay, it's a translocation. So if you go by this one, so the answer for that should be translocation. It is SRY translocation. Here we are not talking about the androgen insensitivity syndrome or the Swyer syndrome. It is the 46XX gonadal dysgenesis, not the 46XY. Next one, most common inherited hypercoagulable state is because of the factor V Leiden mutation. Karyotype sequence, what do we have in karyotype sequence? We had an image here, right? So let me go to that image. Look at this. Karyotype में first is you take the blood sample, then you add it to the culture medium, you incubate it for 3 days, right? And then you arrest the cells in colchicine. And then you fix the cells, Carnoy's fixative. And then the last comes is the Giemsa staining. Okay, the last is the Giemsa staining. So that is basically the sequence of the karyotype. पहले blood लो, फिर आपका था कल्चर मीडियम वाला, फिर बाद में आपका आएगा कॉल्चीसीन, then you have the fixative, and then you have the Giemsa is going to be the last step. So basically the trick to solve this question would have been, if you know that the most common karyotyping is the G banding, G for Giemsa, so the Giemsa stain will come at the last, taking the sample will come the first, right? So this is going to be the first, this is going to be the last. So at least you try to make logical guess by thinking logically कि पहले क्या आएगा कि blood sample और last आएगा Giemsa और बीच में आएगा आपका colchicine ऐड करने वाला, and you have the cell culture here, okay, and you have the cell culture here. So these were the questions from patho. A lot of overlap you would see कि हाँ थोड़ा medicine और patho is basically overlapping, but then again except for few bouncers here, which are the few bouncers here? एक 46XS gonadal dysgenesis wala, right? And this is again a doubtful here. We don't know what's the answer to this. And BRCA1 was a bit confusing, I would say. Otherwise, all the rest of them were good to go with. So pathology, if I put the total number of questions here, so you have 33 to 50. So that is approximately like 18 questions there in pathology. Okay, 18 questions in pathology. Next one, coming to pharmacology. Pharmacology definitely had a lot of bouncers, right? New drugs and all were asked there. So let's start with the first bouncer here. Vancomycin का nomogram कौन सा use करते हैं? The answer to that is METSK. These are the type of questions that you should leave unattempted in the exam because they don't have any concept behind it. If you know it, you know it. Otherwise, you don't know it, right? So vancomycin wala, look at this one. Pharmacokinetics of vancomycin. This is METSK ka study basically. The METSK nomogram is what is used for vancomycin. So the answer to that is METSK. This was easy. Clozapine asked in NEET PG also. Clozapine, the counts low. That is our mnemonic. CLO, the counts low. That is agranulocytosis. True about lithium. It can cause postural tremors in the therapeutic dose also. It is absorbed from the gut. It has teratogenic effect. It is not approved for absence seizures, but it can cause postural tremors. That is the correct answer there. Rett syndrome के लिए नया drug which has been approved. Trofinetide is the drug which is approved. So trofinetide is a drug used to treat Rett syndrome, and it is an analog of glypromate. Glypromate, that is glycine, proline, glutamate. Glypromate का analog है, which is the protein occurring in the brain. Okay, so that is trofinetide for Rett syndrome. Keynote 189 trial wala question, which tells about using pembrolizumab and pemetrexed platinum, that is basically chemotherapy in the non-squamous lung cancer. Okay, so that is what was Keynote 189 trial ka. It was pembrolizumab plus chemotherapy to be used in the lung cancer. Then the next question was priapism side effect, a patient on a mood stabilizer wala drug. Trazodone. Remember our mnemonic, trazodone makes it theta, that is priapism is the side effect. Morphine overdose, what will you give? Naloxone. Scorpion bite, because priapism was the clue given in the question. That was a major clue to tell you that it's a scorpion bite. So the drug to be given would be prazosin. HER2 breast cancer, another drug apart from trastuzumab is lapatinib. This is something that we had discussed in our short INICET class also. Thalidomide teratogenicity mechanism does not involve. The most likely answer appears to be inhibiting the interleukin-4, interleukin-5 because it has anti-inflammatory, it has your anti-angiogenesis wala action also. So thalidomide basically has anti-angiogenesis wala, oxidative stress wala, but mostly the answer is this, though I will put it in the doubtful section. Next one, diabetes mellitus oral drug, which causes satiety and fasting plus postprandial decrease, that is gliptin. It was the major clue that was oral. Pramlintide is given subcutaneous, so the answer there is gliptin. Another question on diabetes drugs. So basically, these are the other topics that we had discussed in short NEET PG wala course also. Genital erythema, vaginitis vagera, that is canagliflozin. Flow, we know that the trick to remember, it goes into the urine. It flows in the urine. So UTI, vaginitis is what it can cause. Cyclosporin wala is a doubtful question. Therapeutic index is a doubtful question. Let me show you this. I tried to hunt for ki cyclosporin wale ka answer kya hoga. But specifically the question mentioned about the intestinal transporter, not the hepatic transporter. So don't know what the answer is this, because cyclosporin, multiple transporters you can see have been mentioned for cyclosporin. BCEP, MRP2, MDR1, BCRP, but all these are the hepatic transporters. Okay, so don't know exactly what will be the answer to the cyclosporin cholestatis wala. Again, therapeutic index, the question was specifically on clinical therapeutic index, and clinically we do not look for lethal dose. In the humans, we don't use for lethal dose. It is the toxic dose by the, right, it is TD50 by the ED50. It is not the lethal dose. So according to me, the lethal wala option seems to be incorrect. The rest of the two options where basically it tells you ki safety and toxicity in the population or in the individual, that is what you have to search for. So this again, I'll put it in the doubtful one. Okay. Next one, what do we have? So exactly, House MD, that is what we said. The question was specifically on the intestinal transporters, and the transporters that I showed you are the hepatic ones. So probably the none of them, then the other option, that is OATP, might be the correct answer there, क्योंकि यहाँ OATP hepatic में नहीं है. But still, I will put it in the doubtful section. Okay. Next one was match the column, mirabegron. At least if you know that mirabegron, BE, the trick, our mnemonic was BE is like 3. Okay, so that is the beta 3 receptor. So then you could have got the answer right and match the column. You have to first check कि मुझे कौन सा definite पता है, and then you can hunt for the options. So mirabegron was beta 3, isoprotrenol was both beta 1, beta 2. That is what was the question there. This was a new drug again, osimertinib. So osimertinib, the mutation is T790M. Okay, that is what is osimertinib, which is used for non-small cell lung cancer, which is T790 mutation, EGFR wala. Okay, so remember it is 790. Options were 890 wale and 790 wale. So the correct option was 790 TM, threonine to methionine. So pharmacology, I would say that it was definitely on the tougher side. A lot of bouncer questions there. 3-4 questions were like that, but the ones which were easy were definitely easy. So we had a total of like 16 questions there in pharmacology. Next one, coming to microbiology, what did we have in micro? A lengthy question, but the gram-positive bacillus in the image was there. So that was listeria, which is motile at lower temperature, non-motile at higher temperature. So that was listeria. Next one was the image-based question of aspergillus with the acute angle branching, right? Both the gross specimen and the histopath, the microscopic was given. It was aspergillus. Next was a mucor, which was aseptate. And then one image of the Neisseria cell membrane, where you were given the image with the pilus there. It was Neisseria. So look at this. I think this was the same image that was given, right? So remember that this is what was given, the pilus. This was also mentioned, the capsular polysaccharide, which determines the serogroup of the bacteria. And this is basically Neisseria. Okay, that is Neisseria. So that was Neisseria. Next, invasive candidiasis wala, where you were given pseudo hyphae and the budding yeast were given. So the yeast like organism, invasive candidiasis, जो post heart transplant वाला question था. Okay. Next one, toxoplasma cat feces. What form is present? It is oocyst. So look at this. The definitive host, which is the cat, the oocysts are shed in the feces. Okay. So remember, in the feces is the oocyst. कफर सेल्स में किसके कफर सेल्स में कौन सा ऑर्गेनिज्म दिखता है? कफर सेल्स is the reticuloendothelial system. In that we have Leishmania, right? That is LD bodies. This is a doubtful one that I've put. I don't know what was that image of, where the image was given and you were asked to identify the organism which had some appearance like this, whether it was Cryptococcus or whether it was Leishmania, right? Some question like that, which I'm not sure about what that image showed. Parvovirus, we had 2 questions on parvovirus. One was the parvovirus, the slap cheek appearance. It is associated with pure red cell aplasia. And the other one where you were given the image like this. I think this was the same image given in the exam also. Right, this was the same image given in the exam also, where the liver was shown, the bone marrow and the heart was shown, hydrops fetalis. It was mentioned ascites या कुछ develop हो रहा है. Remember, this is vertical transmission of parvovirus B19. Because of the anemia, it can lead to heart failure, and also the virus can cause myocarditis and heart arrest by direct infection. That is what is also given. So parvovirus can directly cause myocarditis as well. So remember, even for that it is parvovirus. Okay, so Dave, thank you for those options. So 1,800 to 1,000 kilocalories is high fat, and it is more than 50%. That is what the answer will be there. Okay, that is what the answer will be there. Okay, next one, where you had a question, keep starting May, the test is negative, but with higher dilutions, the test is positive. Basically, the question on the prozone phenomenon. The prozone is because of the antibodies excess. The postzone is because of the increased antigens. So look at this one. The prozone phenomenon is because of the antibody excess. Prozone is antibody excess. With the higher dilution, the zone of equivalence is reached. So you solve this by dilution. Okay. Branching filament, which was a major clue in a clinical scenario question, the answer to that was nocardia. Another confusing and a bouncer question there, which was related basically to drug susceptibility. The stenotrophomonas seems to be answered there. I don't know whether I forgot to put the image here, it seems, for stenotrophomonas, where one of this reference article tells the susceptibility to cotrimoxazole and ticarcillin clavulanic acid wala. It is resistant to rest. So the answer seems to be stenotrophomonas there. Hepatitis B serology, right? This graph there. The trick to remember is the one which is constantly present in the blood. Remember C for C. Constant is NT-HBC. Right, so the one which was showing the plateau, which is always present, it is not going down. That was NT-HBC. Remember, C is constantly present. Next image, the Mytica image, which was Susugamushi orientia. Right, do not get confused between the mite and the tick. This was the image given in the exam, which was the mite, right, the sugar rosses. So that is the Susugamushi. Bioterrorism. Does anyone remember the options to bioterrorism? Does anyone remember the options to the question of bioterrorism and what was the answer to that? Because there is no category D there, right? We have category A, category B, and category C. So not sure about this one as well. So I'll put it in the query section there. Right. If anybody knows about the options that were given, you can definitely let me know. Next was protein folding disease is CJD. The prion disease, it is the protein folding. ठीक है. Okay, so that was about microbiology, where you have quite a few questions in microbiology from 67 to 83. That makes it how many questions? 67 to 83. So that's approximately a question of 17 questions in microbiology. Okay. कैटेगरी डी होता है क्या? कैटेगरी डी कुछ री एमर्जिंग करके कैटेगरी आया है क्या? आई कुड नॉट फाइंड एनीथिंग ऑन दैट. सो कैटेगरी डी तो कुछ होता ही नहीं है, पता नहीं. Let me know if there's something or you've read about it or you know about it. I'm pretty sure that you guys know much more and you read much more than me. So category D wala, I don't know. Okay. Coming to FMT, FMT was relatively on the easier side, I would say. How many questions in FMT? It is 9 questions in FMT that we have, right? So first one, which of these is not a finding in ante-mortem drowning? Does not confirm ante-mortem. Washerman hands, they can be present in post-mortem also. So that was incorrect. Okay. Yeah, I think so. That was given. Category D was re-emerging diseases, but I could not find anything like that when I tried to Google it. So Google Baba se I tried to ask. So ऐसा कुछ दिखा नहीं कि category D is re-emerging. ऐसा कोई category है. दो category B वाला, I don't know about that as well. Coming to the next one, a question on the post-mortem changes where the option of adipocele, the post-mortem staining was given. So this seemed to be a false statement. कि drowning में the post-mortem staining is in feet. In hanging, the post-mortem staining is in feet, right? In drowning, it is the face, the head, and the neck where you have. Okay. Next, you have only abrasion collar present. It is distant shot, right? It's only in distant shot, only abrasion collar is present. No blackening, no tattooing is present in distant. Rape victim. Again, this seems to be a confusing question. Don't know कि examiner के दिमाग में क्या था, because it was a history of 2 days and it was कि what will the doctor do first? Detailed history seems to be the answer, क्योंकि कोई भी आया पहले तो हम detailed history करेंगे. Direct consent नहीं लेंगे, but we don't know what the examiner was thinking. Maybe 2 दिन हो गए, history है हमारे पास, direct आप consent लो examination के लिए, so we don't know about that. Cocaine के लिए tactile hallucinations, formication. Alcohol, drunk but not under influence, because the breath test was positive but the motor coordination was normal. So the patient was drunk but not under influence. Blackfoot, arsenic, easy. We know the story mnemonic. I hope all of you know that. Hippie girl wearing the black footwear. So that was Blackfoot. Image of antemortem burn blister which had the vital wala sign, the red margin. और आजू बाजू में पूरा ब्लैक ब्लैक था बर्निंग वाला, दैट वाज एंटीमॉर्टम बर्न ब्लिस्टर. स्नेक बाइट, द राइट डज नॉट इंक्लूड incision. The right में the I is immobilization, it is not incision. So incision is not included. Okay, so that is for FMT. Coming to PSM, another completely bouncer subject there in the INICET exam. Very unpredictable questions there. So what did we have here? एक था calculate करो kappa incidence, kappa statistic. I don't know what the answer is to that. It's basically to compare the 2 trials, the 2 studies. Okay. Next one, trials reporting. So in the trials reporting, this is what I have got here. ये तो आपका right वाला है. Do it right for the snake bite. I is immobilization. This is the reporting guidelines for the study designs. That is what I found here. So for RCT, it is consort. Easiest was कि case report के लिए it is care. So when it is a care guidelines, if we would have thought like थोड़ा logically, तो शायद answer मिल जाता कि it is case report is care. Okay. Prisma is for systematic review. SM Prisma is for systematic review. Consort is for randomized control trial. I don't know what were the other options, but at least case report is care. For RCT, it is consort. Okay, and Prisma is for systematic review. Okay, Prisma is for systematic review. Mean median mode वाला जो क्वेश्चन था, moves was there. Don't know what was the answer to that. Mean median mode. So again, I tried to hunt for that, and this is what I found. So mode, is it qualitative or is it quantitative? So out of the three measures of central tendency, mean, median, mode, remember mode is the only one which can be for both qualitative data as well as quantitative data, while the mean and the median is only for quantitative data. So mode is qualitative, seems to be correct there. The incorrect one seems to be key. The median is not based on all the observations, right? So basically what that option meant is, now having read into that, it is based on the arranging of the observations. It does not depend on कि how skewed the observations are. कि observation की value 1 to 10 है, कि ये 1 to 100 है, या outliers है कि 1 2 3 4 और एक 100 है, या ये 1 2 3 4 5 6 10 है, उस पर डिपेंड नहीं करता. So it is not based on the values of the observations. So that is what is the median. So this might be the correct one here. The answer might be the median is based on all observations is the false statement. Mode can be qualitative and quantitative also. Okay. Incubation period, hepatitis A 50 days, syphilis 90 days, varicella 21 days, SARS 10 days. Match the column wala question. Kaplan-Meier confidence bands, the technique is Hall-Wellner bands. Okay, Hall-Wellner. Look at this one. The methods for determining this confidence bands, one is this Hall-Wellner method. Okay, so another bouncer question there, Hall-Wellner method. Test for normalcy, look at this one. Histogram plotting, box plot, and you have the Shapiro-Wilk test. So all of them, these are used for the test for assessing normality. आगे है आपके Kolmogorov, Anderson, Darling test. So remember that it is basically these are for the normalcy. Shapiro-Wilk, Box-Fixer, and histogram. I'm not sure about the answer to this one. If anybody knows, please do let me know. Where the question mentioned कि DPT दिया, फिर inconsolable crying हुआ, तो next time क्या देंगे? When I tried to search for that, right, but then I still feel that that might not be the answer क्योंकि clinically हम lethal dose नहीं देखते हैं क्योंकि humans में lethal नहीं रहता है. So we should give DPT because one of the resources said that inconsolable cry is not a contraindication to give DPT. So this I put in the query section because I am not sure of this answer, but this is what I found. We'll have to still look into it. Okay. Another question where the formula was given, that was the formula for the standard deviation. That seems to be a repeat question, has been asked in the previous also. Okay. Right. Next one, the type of study seemed to be like a nested case control study, जहाँ cohort था, फिर उनमें cancer हुआ, फिर हमने वापस देखा the nested case control. Okay. Next one, ENT. This was doubtful whether it's auditory neuropathy or cochlear otosclerosis. I don't know the answer to this. Right. Confusing one. Rhinosporidiosis was easy where there was polypoid structure, south ka patient tha, and you could see the sporangium jaisa in the image. Okay. And the image of the nasociliary nerve block, which was near the canthus, seemed to be the nasociliary nerve block. Anterior ethmoidal nerve block is more down on the nose, the lateral side. So nasociliary seems to be a better answer than the anterior ethmoidal. So ENT में से ये तीन questions थे. You could also put the E. colima here. So maybe one E. colima was put by the anatomy examiner and one E. colima was put by the ENT examiner और दोनों को पता नहीं था कि उसने भी डाला है. So it got repeated. Okay. So ENT. Coming to ophthalmology, one of the other bouncer wala subject. Yeah, one option was give DT, but that's what I'm saying ki because one of the resources mentioned that inconsolable cry is not a contraindication to not give DPT. But like you're mentioning, fever was also mentioned. So as I said, I'm not sure of the answer of that question. Next one. Ophthalmology में perimetry वाला जो glaucoma वाला question था, static, kinetic and all of that, the correct answer was it should be associated with optic nerve head abnormalities. To call it that, it's because of glaucoma. That was the correct answer there. Okay. Okay, so this one, nested case control, is something also which I would like to put in the confusing one, because don't exactly remember the question and what were the options. So we'll have to check for that as well. Next one, एक गंदा सा question on the VOR. The VOR gain कितना होना चाहिए? The answer to that is 1. Okay, the VOR gain should be 1. So what is a normal gain for VOR? This is what I found. It is close to 1. That is a normal value. Okay, that is a normal value. Okay. Next one, image-based question, where I think the answer was already given in the image itself. The canal of Pettit, the red arrow marking to that area. What are the types of direct gonioscopy? The copies and the Richardson are the direct. So look at this one, direct gonioscopy. Copies and Richardson are direct. You have the other names also here. Indirect, Goldman and Zeiss, they are indirect. Okay. So this is basically direct is Copies and Richardson. Phenylephrine blanching was there. It was episcleritis, nodular episcleritis. What is the sequence of the stain? I am not sure of this. But first, the one thing that we know is first is fluorescein. What comes the next after that? So this I'm putting because I'm not sure of the answer to this. If anybody knows, you can let me know. कि सबसे पहले फ्लोरोसेंट है, ये तो है कि पहले फ्लोरोसेंट आता है, फिर लिसामिन आता है, कि फिर रोज बेंगॉल आता है. I think it's Lissamin and the Rose Bengal. That is what the sequence is. But we need to confirm this. Okay, we need to confirm this. Coming to the next one here. So that was Ophthal. Again, I would say Ophthal was one of the bouncer subjects here in INICET. You have 1, 2, 3, 4, 5, 6 questions in Ophthal. Right? 6 questions. Okay. Okay, medicine, anion gap calculate करना था. The good thing was कि उसमें 39 option में नहीं था. If you include the potassium, then you get the answer 39, but it was not in the options. That was great. So the correct answer was 35 wala. Okay, 35 wala. The ECG of the torsides D pointers, the waxing waning type wala जो दिख रहा था, that was easy. Rectal temperature, the false statement was it is lower than axillary. That is false. It is higher than axillary. I had to put it somewhere. Ki rectal temperatures are generally higher than the oral. That is what we have there. And there was one more thing which was there, which I don't think I've put here. Right, वो tympanic वाला भी कुछ था. या वो tympanic वाला था कि tympanic membrane values are lower than the rectal temperature. I think one of the option was ये वाला. So I don't exactly remember the options there, but rectal temperature is not lower than the axillary temperature, and we do compare it with the urinary temperature also in factitious fevers. That is also correct. Okay, that is also correct. एक जो dog bite वाला था, where the patient had a history of splenectomy. So what will you do? Not just observe, give amoxiclav. Okay, amoxiclav. Subclinical myocarditis, all the investigations were positive. So what do we have there? This is basically a reference from your Harrison's. So this is from Harrison's, which says that possible subclinical acute myocarditis is diagnosed where it is no symptoms, right? But there are elevated biomarkers. That means troponin is high. ECG में suggestive है. Ventricular ejection fraction भी कम है. और regional wall motion abnormality भी है. So all of this is correct. Okay, all the investigations basically are correct for subclinical myocarditis. Where will you see the AR murmur? It's an early diastolic murmur, so ventricular diastole. Auscultation areas, I don't know how the examiner asked this question. Left side में पूछा था, but aortic area तो हमारा right side में आता है. Right? We have seen the mnemonic here. All people enjoy the money. So PETM, at least we know कि P ऊपर है, M is the last one, M is सबसे नीचे. Aortic तो वैसे right side में आता है ना? So don't know, this is like a confusing one कि यहाँ पे left side में कौन सा आया था. ठीक है? Hemi neglect वाला question था जहाँ image based question you were given and the patient could not draw the left side वाला image. So left side hemi neglect, it's a non-dominant parietal lobe. It is the right parietal lobe. Okay, it is a right parietal lobe. Thymoma, what is the correct statement for thymoma? It is the most common tumor of the thymus. That is the correct statement there. Okay, it is not the posterior mediastinum. X-ray is not the investigation of choice. We do CT for there. Acha, palpitations was in the options. Then you will rule out palpitations because it is a clinical feature. So it is not going to be subclinical. I think this was more of a common sense का question कि subclinical मतलब clinical symptoms नहीं है. Okay. Adrenal, I think we had discussed this in one of the one-liners wala jo radiology wala tha, where we were discussing adrenal. Adrenal ka the most common incidental lesion in adrenal is the non-functioning adenoma. Okay, adenoma is the most common. Severe COVID. The correct answer seems to be this is not severe COVID. More than 50% is severe COVID. Let me show you this. So severe one is basically where the respiratory rate is more than 30. Does anyone remember the options here? SpO2 एक 87 दिया था, so less than 93 is severe, and this is more than 50% on CT imaging, not just 42%, it is more than 50. So this is basically your criteria to call it severe COVID. Okay, so 42% वाला नहीं है. Okay, right. What was the answer to that ICU pneumonia? I think there was one chest X-ray given जहाँ pneumonia था और फिर दिया था कि patient को ICU में shift कर रहे हैं. तो does anybody knows the answer to that? What was the answer to that? I think Livoflox wala tha, Livoflox plus azithro, something like that. Probably. I'll put it in the query wala. Okay, I don't know the answer to that. Okay. ठीक है. But ICU में shift कर रहे थे ना patient को. So I don't know the answer to this one. I don't remember that. So this is query. ECG RR monitor, इसका भी नहीं पता कि when you were shown that the respiratory rate वाला and the blood pressure was 80/40. इसका भी answer not sure of this one. Next was kidney biopsy. Kidney biopsy, if anybody knows the options and the correct answer to that. This is also something that we need to look for. पता नहीं. Cefta plus azithro should be the answer there. ठीक है. I'll take it that way. Okay, so we'll check there. Next one, TTP में plasma exchange. The answer is for von Willebrand factor वाला. The multimers is what it removes. That is what is the answer for the TTP, the plasma exchange वाला. Okay. Next one, reversible dementia, except Lewy body. The rest were reversible. Okay, the normal pressure hydrocephalus, vitamin B12 deficiency, and I don't remember the other option there. So look at the reversible and the non-reversible. This is reversible. Normal pressure hydrocephalus, metabolic is reversible. Okay. Okay, let's go on to the next one. This is also a query mark that I've put where you had a patient with the scleroderma wala. Which was scleroderma, and along with that there was myopathy. So whether it was because the option did not mention U1 RNP, it mentioned U3 RNP, and there was this NTPM and SCL. When I tried to search for that, both of them are given when you have scleroderma with the muscle wala features. Even this seems to be correct, the NTPM SCL. Okay, right. Next one. OSA ये क्यों नहीं है? OSA क्यों नहीं है? The option did not mention U1 RNP but U3 RNP. Okay, so that is why I am confused here whether it is NT-PM-SCL. The PM is basically like polymyositis. That is what was mentioned there. SCL के साथ और कुछ था. These were not the routine. NT-SCL positive already दिया था. OSA, because it did mention the daytime sleepiness. Right, whenever there's daytime sleepiness, we either think narcolepsy or OSA. So this again, I'll put it as a query mark, whether it is OSA or whether it is hypoventilation, daytime sleepiness tha. So we will again check for that. Okay. Alcoholic liver disease, GGT, is the most specific, right? This was easy. Asbestosis is the base of the lung. Kaplan is the coal workers. Silicosis is crazy pavement. And you have mesothelioma. There is pleural effusion without the shift. Okay? Right. So that's what I said. I'll put it as a query mark whether this is OSA or obesity hypoventilation syndrome. Okay. This was easy. Babinski sign wala image. Thrombocytopenia prophylactic. What I found is 50,000 is what is given. So guidelines recommend a platelet count threshold of 50,000 prior to a major surgery. Non-neurological, if it's a brain surgery, eye surgery, then it is 1 lakh. Okay. So remember that it is 50,000, which seems to be the correct answer. Vomiting में क्या होता है? Metabolic alkalosis, hypokalemia, hypochloremia. This is similar to CHPS. Then there was this image of phycomycosis because vegetative material वाला कुछ history दिया हुआ था, है ना? तो वो fungal वाला था phycomycosis. Iron deficiency anemia, the TIBC increases, the rest of them decreases. We all know this. TIBC increases and the rest decreases. High output cardiac failure, not seen in cor pulmonale. It is seen in anemia. It is seen in AV fistula, and it is also seen in beriberi. Right, the wet beriberi we know is cardiac symptoms. So it is cor pulmonale में नहीं दिखेगा. Lap cholecystectomy urine output. I don't know. I do not remember the options to that. But this is what is the general output that is mentioned in the adults. 0.5 to 1 ml per kg per hour. Okay, 0.5 to 1 ml per kg per hour. Okay. Massive transfusion complication. This is like a controversial question because if that's what I said, I show you the screenshot, the reference from the Bailey and Love. It mentions hypokalemia, hyperkalemia both. Complications from massive transfusion. It mentions hypothermia also. It mentions hypocalcemia also. It does not mention hypomagnesemia. But other references mention hypomagnesemia also. They do not mention hypokalemia. So examiner ने कहाँ से उठाया पता नहीं. The answer is hypomagnesemia or hypokalemia. We do not know there. It's sort of confusing there. The right angle forceps, that was the Mixter's forceps. Again, colon cancer diagnosis. The question was on how will you make or confirm the diagnosis. Just to make the diagnosis, colonoscopy biopsy is enough. CEA is basically for prognosis and staging wala. CECT is also for staging to look for where all it has spread. So again, I don't know that whether the examiner just had colonoscopy in mind to confirm the diagnosis or also the CEA and the CECT, which are basically more for staging. Okay. So this is also sort of controversial. Appendix position, easy one, pelvic tha, subcecal tha, paracecal tha, retrocecal tha. Okay. All right. Next one, hernia reduction. The correct answer seems to be en masse, where the sac with the contents got in. So most likely, again, I'll put it, this is like en masse. SFJK test are the Trendelenburg test and the Morrissey's test, not the Perthes and not the Fagan's test. Not the Perthes or not the Fagan's. So look at this one. The test for SF incompetence is Trendelenburg and Morrissey's. Perthes is for DVT. Fagan's is for perforator. Okay, Fagan's is for perforator. Fat embolism, where there was rash with the femur fracture, which was given in a patient, trauma patient, fat embolism. Trauma patient, pelvic fracture hai. First thing is to do is put a binder or a bed sheet. Rectal prolapse surgery, which are abdominal, which are perineal. So remember that war and pad. Okay, war and pad. That means for abdominal, we have this abdominal approach. You have the Wells repair. Okay, and you also have the Ripstein's. Perineal approach, pad is Altmeier's, Delorme's, and you have the Thisch wiring. So these are perineal, and Ripstein's was the one which is abdominal. Okay, Ripstein's was the one which was abdominal. So remember that Ripstein's is abdominal. The rest are perineal there. TPN complication, aspiration will not be seen. Okay, aspiration will not be seen. Allen's test का image था. Allen's test for the patency of the circulation. Smoking and breast disorders, it increases the risk of duct ectasia for sure. It increases the risk of breast cancer also, and it increases Mondor's also, not with fibroadenoma. This is a confusing one, doubtful here. I put the question of peripheral arterial occlusion. Atheroma is the most common cause. It occurs at night. It occurs with the first step, seems to be incorrect. The symptoms do not tell you about the location. That also seems to be incorrect, because we know that वहाँ पे बटक पेन है कि थाई पेन है कि काफ पेन है. Based on that, we can identify the symptoms, can help us identify the site. It does not occur in the first step itself. It is when the blood supply is decreasing with walking, that is when it occurs, right? So these seem to be incorrect. Okay, so options के हिसाब से जो best bet रहा है वो है एथेरोमा वाला and the night वाला. Amoebic liver abscess, easy one, because there was a history of the dysentery which was given. Okay, dysentery which was given. Ranula image based question was given. Breast conservation, this also is doubtful for me, because definitely radiotherapy is not optional, it's a must. But the other option of axillary dissection करते हैं कि नहीं, not sure. Sentinel lymph node biopsy तो करते हैं, but entire axillary lymph node removal करते हैं कि नहीं पता नहीं. I don't know what the exact option was. Okay, so that is what it is. Duct ectasia, Shahrukh, definitely has an association with smoking. Smoking increases the risk of duct ectasia. Coming to OBGYN PCOS वाला patient, क्या क्या treatment होगा? Weight reduction, metformin and clomiphene. All of you agree to that? Weight reduction, clomiphene and metformin. Primary amenorrhea, when will you do the evaluation or the investigation? So this is what I found on primary amenorrhea. So remember that it is evaluation should be undertaken if there are no secondary sex characters by 13 years, and it is saying that after the breast development, if menarche has not occurred 5 years after, while our option said it was 3 years. So that seems to be incorrect. Because 3 years nahi hai, this reference is telling that it is 5 years. And if the patient is 15 years or older and there is no menarche, so this is correct. This seems to be incorrect. Okay, and the secondary sexual characters, the breast development should be by 13 years. And secondary, if it is more than 6 months के लिए cessation here. So right, so that option, it is 5 years after the breast development rather than 3 years. That is what is the correct one there. This is also doubtful. जो primary amenorrhea वाला case था with clitoromegaly which was given, it is 46XY. 5-alpha reductase might be the correct answer there. I don't know whether it's 5-alpha reductase or 17-hydroxylase. But in 5-alpha reductase, the genotype is your XY. The male internal reproductive tract is normal. It said that ki antenatal wala barabar tha. But then you have the feminized external genitalia, right? Clitoris, which is clitoromegaly. So maybe this was 5-alpha reductase deficiency. Not sure about that one. Endometriosis, the next step is ultrasound, that is TVS. The best step is the laparoscopic diagnosis. The next step has to be ultrasound. Okay. Next one, primary dysmenorrhea. When I searched for the references, this option seemed to be correct. Psychological factors have a role in it, but again, it is doubtful. Puberty menorrhagia, the most common cause is an ovulation. Fructose absent in the semen. Fructose absent in the semen. Both block seems to be correct, the seminal vesicles and the ejaculatory duct. Next one, what was incorrect for prolapse? For cystocele, we do not do colpo suspension. It is anterior colporrhaphy, that was incorrect. Rest of the options were correct. FHR acceleration are controlled by the brainstem. OCP, patient on OCP, vaginal discharge, which is acidic pH, lactobacilli are normally present. It is normal discharge. Okay, it is normal discharge. What are clue cells? The cells adherent to the epithelial cells के बाद जो है वो है clue cells. Non-immune hydropes, all except ABO. ABO or RH incompatibility is immune. Rest are non-immune. Not perinatal, rubella, because rubella is in the first trimester. Okay, so it's not in the perinatal period. Fibroid in pregnancy, now the patient having fever, pain, vomiting. So red degeneration is what occurs in pregnancy. Okay, so that is red degeneration. HRT, hormone replacement therapy, it decreases the colon cancer risk was correct. Okay, it does not increase osteoporosis. It does not decrease the breast cancer or endometrial cancer. Basically, it decreases the colon cancer. A patient with painless ulcer, पूरा history दिया हुआ था. Painless ulcer basically points to syphilis, and there was stillbirth wala history also. So the first thing to be done is VDRL, stillbirth at 24 weeks. So first is VDRL in syphilis. Drug not given in endometriosis is estradiol. Cabergoline is given in endometriosis because of its anti-VEGF wala function. Cabergoline is given, progesterone is given, right? Estradiol is not given. It is combined OC pills that can be given, but not estradiol by itself. So these were the questions from OBGY that you can see, 154 to 170. That means a total of like 17 questions in OBGY is what we had. So significant number of questions, though they were like not very difficult. Few were of course like fact based, कि dysmenorrhea या आपका primary amenorrhea वाला, majority were good enough. Coming to pediatrics, a child with vomiting, diarrhea, altered sensorium bhi tha. So that is, you will be evaluating basically for severe dehydration, hyponatremia, and cortical venous thrombosis also. Match the column which was easy. Edward, Patau's, Huntington's, right, which was easy. Edward is 18, Patau's is 13, Huntington's is trinucleotide repeat. That was an easy one. CFTR is chloride channels. We know that cystic fibrosis is chloride channels. NADA's minor criteria for congenital heart disease. Let me see where are those criteria. Right, so look at this one. The minor criteria is your systolic murmur less than grade 3. Grade 3 or more is a major criteria. All diastolic murmurs are major. Those are not minor. Cyanosis, heart failure is major. Abnormal second sound, abnormal ECG, chest X-ray, blood pressure, these are the minor criteria. So I don't remember that. What were the options, but this is what includes the minor criteria. Okay, this is what includes the minor criteria. Diastolic murmur, all diastolic murmurs are major. MSL suctioning. So remember that we have discussed in short INICET also that in meconium stained liquor, you do suctioning only if the baby is non-vigorous. Suctioning is not recommended in all the neonates, right? And the next is positive pressure ventilation in a newborn. First thing is positive pressure ventilation. Then you had hyper IgM syndrome wala, jहाँ CD40 was deficient. So there will be decreased IgG, there will be increased IgM, hyper IgM. This one I'm not sure. Vaccines contraindicated in immunodeficiency. Okay. Vaccines are contraindicated in immunodeficiency. पता नहीं ये complement वाला है कि Viscott Eldridge है, Dye-George option है, ataxia telangiectasia है. So not sure on this one कि what exactly is the answer to that. Kawasaki IVIG, the answer was already given. That was the best thing. Correct option already लिखा हुआ था. Okay, that was IVIG. Again, don't know, not sure about the Turner mosaic. Should not be evaluated for which ones? कि echo नहीं करना चाहिए, कि ANA नहीं करना चाहिए, या SNHL ऐसा कुछ दिया हुआ था. I am not sure about this one as well. Skin was, dermat was comparatively easy. Pityriasis rosea, where you had an image-based question with the colorate of scales, Christmas-free pattern. That was pityriasis rosea. Wood lamp was easy, match the column, because even if you identify that erythrasma, erythro is red, it is coral red, that would have solved the question. Skin lines, I'm sure that majority of us might have marked the answer as Blaschko's, but remember that Blaschko's, it was not Blaschko's, it was the tension lines, also called as the Langer's lines. So this is where I've put the image here to show you these lines. So look at this. The image was something like this, right? Image ऐसा वाला image था, ऐसा वाला image था, which is the Langer's lines, the skin tension, which is the normal direction of the collagen fibers. Your Blaschko's lines, basically, आप अगर limbs में देखोगे, they are not going like this. Okay, they are parallel and longitudinal. The image had the image like this, which is the image was something like this. Okay, so that is Langer's or tension or relaxation lines. It was not Blaschko's. Okay, Blaschko's में ये spiral आता है head में. Okay, remember that it's the spiral in the head. So that was tension lines, not the Blaschko's lines. Okay, ये क्या हो गया? रुको. Next one, non-scarring alopecia. All of them were non-scarring except the fibrosing. The term itself tells you that fibrosing causes fibrosis, that is scarring. So the telogen effluvium, the androgenetic wala, alopecia wala, वो non-scarring है. Bullous pemphigoid का question था, where you had the linear IgG was mentioned in the question also. Bullous pemphigoid. Pemphigus vulgaris, statement 1. Where it was suprabasal split, and statement 2 where you had the tombstone appearance. Both are correct. Okay, both are correct. Okay. Right. Yes, Rahul, absolutely correct if those were the options. So that was about dermat part. Anesthesia, favorite with INICET, high quality CPR, all are correct except the ventilation wala. Ventilation is not 20 to 25, it is like 10 to 12. Chest compressions are 100 to 120. Recoil होना चाहिए 5 to 6 centimeter होना चाहिए. Ventilation उतना नहीं चाहिए. Ventilator settings वाला जो question था, the answer to that is decrease FiO2 because the FiO2 was very high. The answer is decrease FiO2. Radiology I've also already discussed. Phrygian cap वाला जो ultrasound image था. MRCP where it was choledocholithiasis. AC joint dislocation, it is acromioclavicular plus the coracoclavicular ligaments which are gone. McCune-Albright where it was Shefford-Crook. The polyostotic fibrous dysplasia. USD is not better than mammo. The best answer is it is better for palpable lesion not detected on mammography. That is the incorrect statement there. Banana sign is seen in spina bifida. Chest X-ray rib fracture. There were 3 ribs which seemed to be fractured. 6, 7, 8. But that was not in the option. 7, 8 were obvious ones. So maybe 7, 8 was the correct answer there. Okay. No, I will go with the option of the 2 concludes the 1. Because when I say it is suprabasal split, that is why the basal layer will form the tombstone appearance. So I would put it as yes, the 2 is the conclusion of 1. Right. Examiner का आंसर क्या है मुझे नहीं पता, ठीक है. So that disclaimer will always be there. Okay. Right. LCH diabetes insipidus was not mentioned there. There was hypothyroidism which was mentioned. McCune-Albright has endocrinopathies as well, and Shefford-Crook deformity was what was seen in the image. So we will go with here this one. Right, McCune-Albright. Parathyroid adenoma, where you were given the bilateral calcifications in the kidney, suggestive of medullary nephrocalcinosis, which is because of hypercalcemia. So it was parathyroid adenoma. It was not Wilson's or cystic fibrosis. Okay. Next one. Oh, just give me a minute. I am not able to see the live chat. Yes. Psychiatry, nihilistic delusion was the answer there, where the patient is like, I am dead, how do I eat? Right, we had discussed this just before the exam, nihilistic delusion. Okay, nihilistic delusion. Then you have labile indifference is seen in conversion disorder, easy one. Then you have the SCOFF criteria, which is used for eating disorder. It is not for the mental health. look at this SCOF criteria मैंने डाला था, हाँ. The SCOF questionnaire, which is basically screening for eating disorders in the adults. Do you make yourself sick because you feel uncomfortably full? Do you worry you have lost control over how much you eat? Have you recently lost more than 1 stone in a 3-month period, the weight loss? Do you believe yourself to be fat? Would you say that your food dominates your life? So basically, that is the SCOF criteria, which is for eating disorder. Okay, a score of more than 2 indicates that the patient has anorexia or bulimia. So remember, that's the SCOF questionnaire, which is for eating disorder. I don't remember the options or the answer to this one, the drug or the substance dependence, where it was given that takes over the priority of taking that drug. Right, I don't exactly remember the options to this, so don't know the answer to this. And last one, in orthopedics, osteochondroma malignant change. The correct answer was cartilage cap more than 2 centimeters on MRI. That is the correct answer for osteochondromas. Right. So for majority of the questions, we know that what the answer is. But again, there are few questions where we are not sure of the answer, or they are controversial because we don't know what the examiner has in mind while putting those questions, right? So this is like we have completed all the 200 questions recall in INICET. I was in the mindset ki karu ya nahi karu, should not get a backlash post results ki you said these answers, your recall according to that I got so much score, but post results I'm not getting that score, right? But again, as I said, the purpose here is to learn. In the process of the recall, I have also learned a lot of things, a lot of topics that I also got to learn, and that's the whole purpose of doing this recall. Okay, so that was about all the 200 questions recall. I'll share this PDF if you want on the Telegram group. I'll share across on the Telegram group, Dr. Nikita's Radsynapse. All right. Thank you so much, everyone, for joining in. I hope you have learned out of this. Learning is the main purpose here. Out of every experience, every event in your life, the major purpose is learning. It is not the regret, or it is not crying over whatever has happened or so many silly mistakes you have done in the exam. That is not the purpose here. Okay. Thank you so much, everyone, for joining in. And goodbye, take care, and keep studying, keep revising, and keep winning. And if you think that there is some discrepancy in the recalls or the answers that we have, please do let me know in the comment section so that we can rectify that. Okay. Thank you so much. And yes, see you again soon. Goodbye, and all the very best for the results. Would be waiting to hear from you post results. Okay, definitely would be waiting for that. So all the very best, and stay blessed always. Thank you.